Hello friends, myself Dr. Sanjeet Kumar. Today we are going to start postmortem changes. This is a very important topic. It is complex and intricate changes after death. These changes are the result of complex physiochemical and environmental process. This is very complex. Changes after death. So there are three changes: immediate changes, early changes and the late changes. Immediate changes, it constitutes somatic or clinical death, like a stoppage of circulation, a stoppage of CNS function and a stoppage of respiration. This is the immediate changes. This constitutes somatic or clinical death. Then early changes, it denotes molecular or cellular death. It occurs within 12 to 24 hours after death, like changes in skin, changes in eye, cooling of body or algor mortis, postmortem staining or postmortem hypostasis, rigor mortis or stiffening of body. Late changes, it follows after about 24 hours after death. 24 hours के बाद का changes, late changes, like decomposition or putrefaction and modified form of putrefaction like adipocere formation or mummification. Okay, we will discuss in detail. Immediate changes, a stoppage of circulation, features no pulse, no heartbeat on auscultation, confirmation by ECG. Test, Magnus test, diaphanous test or ICAR test. It may be difficult to hear the heart sound in the flowing condition if they are feeble, if the chest wall is thick and in emphysema. A stoppage of CNS function, loss of both sensory and the motor function, no tone in the muscle, pupils are fixed and dilated, loss of all reflex confirmed by EEG. May be seen during life in the following condition like catalepsy, epilepsy, electrocution, narcosis and vagal inhibition. Then stoppage of respiration, no respiratory movement visible, no respiratory movement appreciated by palpation, no breathing sound can be auscultation. Test, mirror test, feather test or Winslow test. Respiration stop for some period without death in the following condition like drowning, opioid intoxication, preterm infant, obstructive sleep apnea and voluntary act. Early changes. So early changes in skin. Skin become pale and acid white appearance. Loss of elasticity of muscles. Both the changes are due to draining of blood from its small blood vessels or due to cessation of capillary circulation. Lips are dry, brownish and hard due to drying. Then changes in eye. Flaccidity of eyeball. Due to rapid fall of intraocular tension, eyeball becomes flaccid and sink in the orbit. Normal intraocular pressure during life is between 10 to 20 mm of Hg. 1 hour after death, 12 mm of Hg. 2 hours after death, 10 mm Hg. 3 hours after death, 8.5 mm Hg. 8 hours after death, 5 mm Hg. Helps to find out time since death. Then cornea. Cornea becomes opaque and corneal reflex lost. Normally cornea is transparent, after 1 hour become hazy. Cornea becomes opaque in about 6 hours after death. So the cornea can be harvested till this period. 6 घंटे के अंदर ही cornea transplant करना होता है. Classically grey, black or cloudy cornea was considered a sign of death. This is called larger sign. Helps to find out time since death. Cornea may be opaque during life in the following condition: diffuse corneal opacity in glaucoma, localized corneal opacity in the keratitis and corneal ulcer. Corneal reflex may be absent in the following condition: epilepsy, narcotic poisoning, general anesthesia. Then sclera. Sclera develops a film of cell debris, dust, mucus settling on it becomes brown in color. It is triangular in shape with base at the periphery of the cornea. This is called Tachynoir sclerotica. This is Tachynoir. This is triangular shape. Base is at the periphery of the cornea and the apex is at the inner canthus of eye. It is yellowish in color in the beginning, then becomes dark red and then brown, then finally becomes black. Seen during 3 after death when the eye opened but delayed in closed eye. Helps to find out time since death. Pupil becomes oval, triangular or polygonal when pressure is applied over the eyeball with fingers. Pupil initially dilate as iris tone is lost and later becomes constricted due to development of rigor mortis. Then retinal vessels show the fragmentation or the segmentation of the blood column in the retinal vessels. Fragmentation or segmentation of blood column in the retinal vessel seen within few minutes after death, and it persists for 1 hour. This is called Kevorkian sign, railway tracking or cattle tracking. This is called Kevorkian sign, fragmentation or segmentation of blood column in the retinal vessels. It could be due to a rapid loss of blood pressure after death or shrinkage of fibrin in the clotted blood within retinal vessels. This is most reliable eye sign of death. This is the earliest eye sign. Helps to find time since death. Can be visualized by ophthalmoscope. Vitreous humor. It is best medium for the detection of time since death. Vitreous potassium level keep on rising after death. Potassium level keep on rising after death. Method to determine the potassium level: Stomach method or media method. Okay, important question related to thanatology. Loss of circulatory function can be detected by. Loss of circulatory function can be detected by ICAR test, diaphanous test, Magnus test, all of the above. Suspended animation may be seen in all except newborn, drowning, partial hanging, heat stroke. Death is defined by which section of BNS 2023? BNS 2 subclause 4, BNS 2 subclause 6, BNS 2 subclause 8, BNS 2 subclause 10. Tachynoir occurs in open eye after how many hours after death? 1 to 2 hours, 2 to 3 hours, 3 to 4 hours, 4 to 5 hours. The best body fluid for estimation of time since death is CSF, pericardial fluid, serous fluid or vitreous humor. This is all about immediate changes and the early changes. In the early changes, skin changes and the eye changes. Next time we will continue this topic and we will discuss अलगर मोटिस और कूलिंग ऑफ बॉडी। ये 5 क्वेश्चन का आंसर कमेंट में करना है। नेक्स्ट वीडियो बनाएंगे तो उसमें इसका आंसर बताएंगे। ओके, थैंक यू फॉर वॉचिंग।